and diabetes for long enough, then it is difficult to get somebody to exercise. And that means you can only work on the diet side or possibly supplement side. And so that's one of the problems here. So briefly mentioning some of the compensatory mechanisms, which is where the drugs are basically attacking. Blood pressure is typically tightly maintained by a couple of feedback loops. There's a fast feedback loop, which is primarily the autonomic nervous system via baroreceptors. And if these baroreceptors in either the carotid artery or aortic arch sense a change in blood pressure, that's rapidly fed back. So if there's atherosclerosis in those areas and blood pressure is lower, then there's going to be a sympathetic response to increase blood pressure to those areas. That's going to affect the heart itself, and also the slow feedback loop is going to affect the kidneys. One other point about this, the sensing mechanisms themselves, the baroreceptors, are in the carotid artery and the aortic arch, and those are areas that are often themselves affected by atherosclerosis. And so that's also a problem. We think that the sensing itself may be thrown off. So the question a lot of people ask, at least when they first learn about this, is, well, if there are feedback loops to control the blood pressure all the time, why is it that blood pressure goes up? And in fact, that answer has not been well documented. But we pretty much know what's going on, which is, even though there are these feedback loops, if there's atherosclerosis and increased peripheral resistance, there are other factors that come into play. So oxygen to the tissue, blood flow to the kidney, those areas, if the tissues are not getting enough oxygen, if the kidney's not getting enough blood flow, and the kidney is primary, if you listen to most renal docs, they'll tell you kidney is primary, kidney takes control. And so if the kidney's not getting enough blood supply, what's going to happen? We're going to have release of renin-angiotensin, we're going to increase blood volume, and we're going to load more blood volume on. And so that's classically seen, and you see that all the way up to congestive heart failure where there's way too much blood volume. So those are all feedback loops. The slow feedback loop, which is sensed primarily by the kidneys, is the renin-angiotensin alterations. And again, this alters blood volume in general. More blood volume is going to increase cardiac output. So these feedback loops, these homeostatic mechanisms, help maintain a constant blood pressure. But oxygen supply or blood supply to the kidneys, these are the key points here. And atherosclerosis throws us all off because it increases peripheral resistance and it decreases blood supply and oxygen supply to the kidneys and tissues. And so these are compensatory mechanisms to increase that. And what the antihypertensive drugs try to do is block these compensatory mechanisms. But again, they're not getting at the underlying problem to begin with in many cases. However, they may help some by lowering blood pressure, and as we've seen, hypertension itself can contribute some to atherosclerosis. But a more sane attack here of the problem, a more sane way to go after the problem, would be to attack the underlying cause in addition to the hypertension that may contribute to things. So that's kind of what I'd like to advocate for. The primacy of the kidney, or why the kidney rules. The control of the renin-angiotensin-aldosterone system is primarily due to kidney feedback. Sympathetic input into the kidney also contributes to the control. So the sympathetic nervous system, the quick input actually contributes back to the kidney. So aldosterone secretion is going to be ruled by beta-1 also. So again, kidney is primary. The kidney also controls another hormone that controls blood volume in general, that's vasopressin or ADH, antidiuretic hormone. And then prostaglandin production, particularly in the kidney, can determine how much volume is excreted. So that's another key point. One other point I want to make here is that prostaglandin synthesis inhibitors, such as NSAIDs, can decrease the effect of diuretics and decrease the effect of getting rid of blood volume. And that goes for not only the drugs that are prostaglandin synthesis inhibitors, that also goes some for the food and plants, some of which also contain prostaglandin synthesis inhibitors to some extent. So be aware that local prostaglandins in the kidney keep the blood flow high to the kidney, keep the GFR up. So that's a